Seems like that's been going on for years. So I just. All right, welcome to another episode of the Better by the Numbers podcast, presented by Live Metrics. We're at the Roundtable of Longevity Clinics with Mr. Miguel Stanley. Miguel, what brings you here?
I got invited to talk on my work on mouth-body connection. So too many times in the longevity space, the mouth gets forgotten. And so everyone looking into how to improve lifespan and health span are trying to figure out how we can improve diagnostics and therapeutics. And obviously many longevity clinics around the world are offering many services that can help patients improve, their overall health. But what many times is overlooked is how many humans have old and or outdated dental work in their mouths. So there's hundreds of millions of people around the world that have outdated, old, or poorly executed dental treatments in their mouth that is now not offering, let's say, a immune-friendly version of dentistry. So what my work is we're looking at how to improve diagnostics, treatment planning, and therapeutics to replace old and outdated dentistry. Just very quickly, we don't think twice when a hip surgery needs redoing after 15, 20 years. It's called revision hip surgery, or a pacemaker, or a retina, or a knee. So in orthopedics, those orthopedic prosthetics will need to be replaced after a certain amount of time, or even breast implants. But dentistry somehow, if it was done 30, 40 years ago, it's just done and dusted, and it can last forever. So what are the consequences of that in our longevity and in our overall health? And that's what I look into.
Okay. Wow. All right. So, and how many dentists? So you say you're one of the few ones here. How many dentists are in the longevity space currently?
Well, here at this meeting, only 2.
Wow. Okay.
So, and it's the third roundtable. It's the first time. Not many dentists are in this space right now. And I started about a decade ago. I've been doing it for 30 years.
Oh, wow. Okay. And what are you doing, I guess, to bridge the gap there? Because, I mean, obviously, you're saying it's left out a lot.
Well,
how important is it to inject dentistry into the space?
Yeah, dentistry got hijacked by aesthetics, by cosmetics. Now, I'm a cosmetic dentist myself. I lecture all over the world on this. I've lectured in over 50 countries on the topic. I run a practice in Lisbon, Portugal called the White Clinic. And so I have no shareholders, no private equity. I don't work with insurance companies. So for 30 years, think of my clinic as a lab. And, I'm pretty much like a crazy scientist trying to figure out, I don't care if this makes money or not. Let me look into things. And so when you're not worried about the bottom line, and and I have, a lot of patience, I'm very lucky, I'm very fortunate in my business. So I get to connect dots as a practitioner, as long as they're evidence-based. I'm not running crazy trials here.
Right.
But, hey, what if we put a hyperbaric oxygen chamber in my clinic and see how that it could impact the healing after a tooth extraction? So wisdom tooth extraction, one of the most common surgeries in the world. People go home with an ice pack. I'm like, well, let's look at the biohacking industry, and let's bring in infrared, red light, hyperbaric, cryotherapy. And I have it, and I've been using it, and it's unbelievable. So I'm like, well, why aren't we bringing all the longevity space, all the biohacking space into a dental clinic? And that's what I did, and that's what I do. It's pretty cool.
You must have some clinical studies.
We do.
Yeah. What's your...
Well, I don't sell anything. I don't have any products.
Right.
My product is my work. It's my patients. We have clients flying in from all over the world for this. And so we measure chair side above and beyond. So above and beyond a normal x-ray. So if you go to the dentist across America today or around the world, you'll probably be greeted by a very nice dentist that will look into your mouth and take some x-rays.
Right. Yep.
That hasn't changed for 100 years.
Wow.
So what we're doing is saliva, biomarkers, chairside, with instant actionable discoveries such as active MMP8, which is a collagenenic breakdown, which appears in the saliva. So if you have a lot of collagen breakdown from excess pathogens in your mouth, then we can measure that. And we also do a little chairside vitamin D prick blood spot,
Yeah.
and we're measuring patients' vitamin D. Now, why is active MMP8 and vitamin D chairside above and beyond the simple X-ray important? Well, periodontal illness is being connected to cardiovascular diabetes, Alzheimer's, and more recently, according to JAMA, the Journal of American Medical Association, pancreatic cancer, the presence of a certain pathogen or bacteria called P. gingivalis. So it's one of the most studied illnesses in the world. But the way that we treat it hasn't really changed in 50 years. So we're combining that diagnostic chairside with advanced procedures using lasers, erbium YAG lasers to decontaminate the socket. And with these specific protocols, by also giving our patients certain supplements, so supplementing them with vitamin D, K2, magnesium, and a bunch of other minerals and supplements to get their immune systems more elevated, they can combat periodontal illness much better. And by combining new technologies, we're actually reducing our patients' overall blood markers by 87% in the first 6 months. So we're measuring the data. It's quite cool.
So I guess you're saying that you can start at the mouth, or that the mouth is an indicator
Well,
of what's going on.
There's two types of humans
Right.
when it comes to dentistry.
Mm.
Pure humans and altered humans. So think about that. So if you've got a tattoo, you're an altered human, right? So if you've had an amputation, if you've got a prosthetic, if you've got I don't know. So you're superhuman. Bionic.
Right, yeah,
Bionic.
there we go.
Bionic, But dentists are the profession that alters humans the most. And it's
Yep.
in your head.
Yep.
And there's no oversight, there's no checks and balances. And I'm a dentist. I love my brothers and sisters out there working hard. It's a tough profession, but when the work starts aging, we're held to blame that the work didn't last forever. We're the only medical profession where our work has to last forever, and I don't think that's cool. So we need more.
Yeah, kind of unfair.
We need more support from the medical organizations. That's what I'm here to ask for help, better diagnostics, to support this, this thing that I'm doing, that revision dentistry. And so I'll give you an example.
Yeah.
The amount of patients today that are battling cancer, that, so they go to, the cancer centers, I don't know, the top cancer center. That cancer center only, like, the body ends at ENT, ear, nose, throat. They will not have a dentist. Most of them don't have a dentist. So here we are measuring all of these inflammatory biomarkers. And if it's cancer or autoimmune, we're looking for biomarkers, right? And things are off the chart. We're doing all of these treatments to help patients, cure their cancer. But there's no prescribed test to look into the mouth. What if that patient has 12 old root canals that are 40 years old with cysts and infections? No one's looking at this. What if they have implants that are now surrounded by bacteria and fungus? It's called periimplantitis, which is a man-made disease. And all of this is literally in the bone, in the skull, and the blood is circulating. And we know that we can absorb things through our mouth very quickly. That's why, mouth is an instant way to absorb stuff. Our gums are very sensitive. There's a lot of, blood vessels there. It's very close, it's in our head. And why are we not seeing this? And it's very simple. Doctors and dentists don't communicate. And the language that communicates doctors to dentists is inflammation.
So there's only one thing that actually brings.
And that's what I'm loving about this meeting. Everyone's talking about data-driven diagnostics. And so how come dentistry is not part of that? So I'll invite anybody to reach out. Anybody who wants to help us with this conversation.
Yeah.
And bring dentistry back into the conversation of longevity. Should never have left in the first place.
It needs to be. Exactly. There should be more of you guys.
It needs to be. You can't,
honestly.
Everybody thinks that when you think about teeth, you think about people with healthy teeth. I bet you've got great teeth, right?
Hopefully. Yeah,
right.
That's what I hope for.
Are you an altered human? Or
yes, altered.
You're altered.
Completely altered.
All right. How good does that work? Do you know?
Not at all. No.
So most people
10 years ago. So,
and when you say rate your dentist, nice, affordable, good person, super cool, nice office, good price, works with my insurance. None of that matters in the discussion of longevity. Those aren't KPIs for success in healthcare. Yeah. It's like rate your cardiologist. Oh man, he's awesome. It's like no. Like what's his success rate?
Wow. Okay.
No
yeah,
one's thinking about that.
yeah,
You didn't expect this in this
not at all.
conversation.
No, not at all. But that's actually really good to think about, because I mean, how many? What are the most common diseases that come through the mouth? Like from what you found, what have what's-
Okay, well, studies will show that there's over 22 non-communicable diseases that are directly linked to oral infection and oral inflammation. So one of the tragedies is you've got a lot of subclinical infection and subclinical inflammation, right? The low-grade chronic infection. So some of these diseases will be, not by order of importance,
Right.
Alzheimer's, cardiovascular, diabetes, fibromyalgia, Crohn's disease, chronic fatigue syndrome, and the list keeps on going on, and cancer.
Wow.
Directly
So
linked to oral
you're looking
inflammation.
at literally the subject of longevity. People are doing all these tests,
And no one's looking in the mouth.
Nobody's looking at the mouth.
No one's looking in
You're
the
gonna
mouth.
miss the mark, and you're still going to get a patient that's sick regardless of all the tests they did. That's
No one's
yeah.
looking at the mouth.
yeah. That's
And in
huge.
America,
Yeah.
when you go to the dentist, they're doing a checkup with a X-ray technique called FMX, which are these little film X-rays, and I'll take about 12 of them to get a general overview of the mouth. That's so outdated, it's almost embarrassing. And we've had cone beam 3D digital CT scans that do a 3D imaging of the skull. They've been around for almost 30 years now. They're expensive machines. I'm on my third generation. I work with a company that's based in Atlanta called CareStream Dental. Shout out to CareStream. Not sponsored,
Not
just a
sponsored,
great.
but hey, shout out.
I've been working with them for 20 years now. Actually 25. But why are we not using 3D cone beam to do instant and one of the things I heard, and I don't know if it's true, I'm not an American physician, is that doctors, dentists are legally bound to what they see in the image. And so the smaller the X-ray, the less the work, the less the liabilities. Isn't that a tragedy?
Yes.
Yeah.
Wow.
But
I mean, Western medicine is always
so
up to
now,
something, man.
well, when you're working to not get sued, you take less risks, and that's not healthcare, that's fear care.
Yeah.
So I think AI is going to be completely disruptive, because what happens when you've got your meta glasses on and it's filming the conversation between you and your healthcare provider, and your healthcare provider is not giving you state-of-the-art information, and it's your earpiece and your meta glasses is saying that ain't true.
Yeah.
It's going to change the game. So
Yeah.
I think
a lot of doctors are going to be called out. A lot of dentists are going to be called out.
well, it's a really important time for people to wake up and join the game. And if your business plan and your strategy is to stay in the past, then you better not be digital.
Yep. Oh my God. Man,
Yeah.
I think you got to get a lot more of you to these events. Man,
Yeah.
Because that actually.
I'd
makes
like
so much
that.
sense.
You
Yeah.
can follow me at Dr. Miguel Stanley on Instagram.
Nice. Do you have a website?
MiguelStanley.com.
Perfect. Miguel Stanley, thank you so much for joining us.
Thank you.
This was another episode of Better by the Moment podcast presented by Life Metrics. We'll see you guys on the next one. Dude.